Yeah.
Hi, Dr. Eric Lund here, your local Roseville and St. Paul chiropractor, specializing in short-term care for your neck and back pain. And today we have Jamie with us. Jamie is a nurse, and she's been experiencing some neck pain, upper back pain, and lower back pain. And so we're going to go through and show you what a typical treatment for neck and back pain relief would be. So I've already examined her. I know where the problem areas are, and so we're going to go through and do the treatment. So for Jamie, she had tight muscles throughout her neck and upper back. Some of the common ones on her are the scalenes, the upper traps, and a muscle called the levator scapulae. And so we're going to go through and work those muscles out. So I'll have you bend your head right here, we'll hold pressure, and then you're going to take your left ear to your left shoulder. Good. And then you can come all the way back. Do that about 4 more times. And so what we're doing here is more of an active release here, where I'm holding some light pressure on the muscle as she takes it through the range of motion. And it's a real nice way or gentle way to release the muscle and to have the knots within these muscles dissolve. And we'll do one more pass. And what does that feel like?
That's good. It's like releases.
Okay.
The muscle, I feel like it's kind of, yeah.
Okay. And then what we're going to do next is for the upper traps and the levator scapulae, we'll use kind of a combination move. And so your head's going to come back like this. And then what you'll do is you'll put your arm out, and then you're going to bring your chin to your opposite knee. And then we'll just hold pressure through there. Good. And then the arm will come down. Yep, and then the head will come back, and then we'll bring the arm up. So we'll bring the arm up first, yep, and then go chin to the opposite knee. Perfect. Okay, and we'll just continue to repeat that.
I can feel that.
Hold the arm up, yep, good. We'll do one more pass with that. Good. Now we'll do okay. Now we'll do the left side here. So we'll start with bring your ear here, and then let's go the opposite ear. Except for this time, we'll do the one that we did first last time. So you'll go here, and then your right ear will touch your right shoulder. Yep, very good. And there's different ways that you can release muscles, but when you kind of hold pressure and then have the muscle go through its active range of motion, it's a real effective way to work the tightness and work the knots out of these muscles. Good. We'll do one more pass. Very good. Okay, and then now what we'll do is we'll work this one. So we'll start off this way, and then it'll be arm up, but now this time you'll bring your chin to your right knee.
Like that.
Yep, and kind of flex down. Yep, just like that.
Okay.
Yep, and then you can come back and drop the arm, and then we'll have the arm up. And then, yep, go through perfect, just like that. And then, yep, so then we'll bring the head all the way back. Yep, perfect. We'll do a couple more passes like that. And the reason why I'm having her bring her head back, and the reason why it's specific about the positions that you start in, is that we want to take the muscle in its shortest position, and then we lengthen it out as I hold the pressure. We'll do one more pass here. Very good.
Yeah, you're definitely getting like all those tight muscles.
So then what we'll do is next we'll have you lay on your stomach, please, and face go right in there. And so now we've worked the muscles in the neck and upper back region, and now we're going to go through and work some of the muscles in the lower back region. And so for Jamie, one of the muscles that was particularly tight is the QL, or what's called the quadratus lumborum. And this is a muscle where when it's tight, it'll cause lower back pain. This muscle, if you ever experience where it's difficult to turn over in bed, usually that's an indication that this muscle is very tight. And also too, this muscle is problematic if you have increased pain when you're going from a seated to a standing position. And if you've ever had pain where you're trying to put your pants on and you're standing up and doing that and that's painful, that's another indication that this muscle is overly tight and probably contributing to your pain. And so now all I'm doing here is I'm just I'm getting on that muscle, I'm holding some pressure, and it's releasing that muscle, and it's working the knots out of the muscle. And so when we do this, it's kind of, there's some soreness to it, but it's a good soreness. Okay, and so then you can just kind of feel that muscle releasing underneath your hands here. And then the other muscle that was particularly tight for her was a muscle that's called the gluteus medius. And so we'll release that muscle next, just the same way, we're just holding pressure. And the gluteus medius, this is a common muscle that's very tight when people, again, have lower back pain. They may have pain that goes into their butt or their gluteal region. And oftentimes people with a very tight gluteus medius, they'll talk about how when they start walking or after they've been walking for a while, that's when they start to have their lower back pain, or that pain will start to worsen. And how would you describe, what does it feel like when I'm just holding pressure or working out these muscles?
It's definitely a tightness, but once you relax it, it's kind of like I can feel like it's kind of loosening it up,
So then what we'll do here is then we're just going to come on the other side here, and we'll work out the same muscles. And now on Jamie, I don't know if you can tell a difference, but just right away when we get on this right side, you can tell that, this muscle is tighter. So does it feel any difference from side to side?
Yeah, now that you said that it's tighter, it definitely feels like my muscles are kind of squeezing.
Sure.
Tight, yeah.
And so typically that's what will happen is if one side or a muscle is tighter than the other, just when we work it out, there may be a little more soreness, or you can feel a difference with that. And that's another thing too, when you're looking at the pain patterns. So a lot of times when people, just like Jamie had described, the lower back pain was more horizontal, like across the belt line. That's an indication that the QLs and the gluteus medius, the muscles that we're working, are more involved. This isn't in Jamie's case, but if she had come in and said, her lower back pain was more vertical, then that makes us look at or evaluate different muscles like the hip flexor. So a lot of people that have tight hip flexors, they'll describe lower back pain in a more vertical distribution of pain versus horizontally. And so now you can start to feel this muscle release, which is what we want to have happen. And we'll do one more pass here right at the lowest part of the muscle. And then we'll work the glute medius on this side as well. And so that's one thing is when you're trying to have your neck and back pain treated, you want to pay attention to where is your pain and what are the factors that make it better or worse, because as far as treatment, that can really clue you in on what structures may be causing your pain. And the other thing that I would just say about the gluteus medius is when this muscle becomes particularly tight, this muscle can also refer symptoms down the leg and basically reproduce a sciatica. So anyone that has leg symptoms going on, you want to make sure that you have this muscle evaluated, because again, it is something that can mimic a disc herniation. Okay, so now that we've released the muscles in her neck and in her back, then what we're going to do now is adjust her neck and back. And so when it comes to neck and back pain relief, there's two important components that we want to address. So one is that we want to work the knots and the tightness out of the muscles. And then the other part is we want to take the joints in the neck and back that are locked up and get them to release. So when you unlock the joints and you work the tight muscles, that's very effective for providing neck and back pain relief. And so what I'm just doing now is I'm just going through the different areas of her neck and her back, and I'm basically feeling for the alignment and also where does it feel the most restricted and locked up. Okay, so we'll do one through here, so I'll have you take a breath in. You can let it all out. Good. Okay. And so now for her lower back, what I'll have you do is you can lay on your left side first and face me over here, please. Set you up here, so we're going to pull this arm out. Cross that there, then you're going to bend this top leg. Keep that leg straight, just like that. Now I have you scooch a little bit closer. Perfect. And so basically what we're going to do with this treatment is I'm going to put a contact on her lower back. She's going to feel some pressure on her knee with my knee. Then I'm going to lean over her and you're going to feel a little bit of a roll.
Okay.
And so when you feel that roll, sometimes some people think that they're getting close to the edge of the table, but that's not the case. You can just kind of try to stay relaxed and kind of let the roll happen. Excellent. I'll have you on the other side, please. Excellent. Now I'll have you on your back, please. And so again, now I'm just going to kind of go through this same procedure that we did with her mid back and lower back, as this go through now in the neck and find where is she most restricted or where are the joints locked up. That tender girl right there.
A little bit, yeah.
And so a lot of times where people are, the joints are the most locked up is when I basically go through and feel that, there'll be some tenderness associated with that. So we'll just go right here. Beautiful.
That feels good.
Excellent. Okay, and then you can have a seat up.
All right.
Good. And so then now, kind of let's have you go through your range of motion with your neck.
That feels a lot better.
Okay. And that's what we're looking for is we're looking for improvement in pain and we're looking for improvement in function. And so if you're experiencing neck or back pain relief, you can come in like Jamie did. Our approach is to get you out of pain and out of the office as quickly as possible. We focus on short-term treatment, so we just take our recommendations one visit at a time and go based upon how you're responding. And we always offer a free consultation to determine if what you're experiencing is something that we can help you with. So thanks for watching, and we'll see you next time.
Thanks, Eric.